Dear all, we will resume. And now we will have the team focused on communication and an evaluation of need for training and the training. And so I welcome Magid Derrida from France, Greet Hendricks from Belgium, and Ginevra Papi from the European Council Leagues.
Thank you, Olivier. Good morning, everybody. So Ginevra and Greet will be online. So just briefly to say you that we will present 2 pilot activities in this session that aim at exploring the feasibility of joint undertaking on vaccine-related issues. The first presentation relates to healthcare professional training, a major topic that we have already discussed this morning. And it will be presented by Greet from the University of Antwerp. I will, in the second part, Ginevra Papi from the Association of European Council League will give you a presentation on communication toward young people. So I will give the floor for the first presentation to Greet, if Greet is with us. Good afternoon, Greet.
I am so, I don't know if you hear me.
Yeah, perfectly. So
okay.
I give you the floor. Thank you, Greet.
Can I see the slides or how do you?
We're going to wait a bit now.
Okay, so since I represent the University of Antwerp, I first want to thank you, or at least the EU-JAV, to be part of the EU-JAV, because as an academic institute, it was not that straightforward to be part, but we, together with a Flemish agency, we succeed to be part of the EU-JAV, and we learned a lot in the work that we did. So what our task was in work package 4 was to look for educational activities. So we created, or our aim was to create a curricula for medical and paramedical, for students and in-service healthcare workers on vaccine and vaccination. So if I can have the next slide. Our task was divided into 4 parts. So we first assessed if there was really a need for training in service and in pre-service, so in students. And there, based on this survey, and on other tools, we developed a curriculum. And later on, we pilot tested this curriculum in a vaccine training. So if I can have the next slide. So I would start with the assessment that we did in healthcare providers that are in service. Therefore, we created what we called a tool. We created the vaccine training barometer. It's an online survey of approximately 12 questions that was used to assess the needs for training of the healthcare providers, but we also tried to monitor the confidence of the healthcare providers to communicate about vaccines. And with this tool, we also tried to collect questions that healthcare providers could not answer when they have talks on vaccines with their patients. So this survey is available in Dutch, English, and Spanish. It's also became available in more languages, but I will come on this topic later when we talk about the sustainability of this vaccine training barometer. We had 2 pilot tests of this barometer. We had it in February 2020 and in January 2021 in Belgium. And we also, to see if this is not only applicable for our setting, we also did it at the University of Barcelona. They did also the vaccine training barometer, and they did it in January 2021. So if I can have the next slide, there we have the results of this pilot testing. We compared the second round of Flanders with the first round in Spain. And what you can see there is that 2 on 3 healthcare providers doesn't feel confident that all to answer questions about vaccines. So it's clear that people are not confident to talk, healthcare providers are not confident to talk about vaccine. And in Belgium even, they mentioned that they didn't gain enough knowledge out of their standard education. This is different with the Spanish part, where you see that half of the people think that they get sufficient knowledge by their standard education. What is very convincing is that more than 90% of the healthcare providers we surveyed, they are willing to follow extra courses. And then out of this survey, we also learned that 50% got questions in the last 3 months that they could not answer. So they get questions where they don't have an answer on. If we compare the first round with the second round, the first round was done before the COVID, and the second round was in Flanders was done in the middle of the COVID pandemic. We see that there is an increase of more than 20% of healthcare providers who get questions they could not answer. So it means that they didn't have the tools to answer questions, and we think that these were questions mostly on COVID. It seems that we can call this tool a barometer, because we can monitoring the amount of questions that are coming up that healthcare providers could not answer. If I can have the next slide. That's what I already mentioned, is that this barometer can be used for monitoring the questions that are coming up, but also to monitor the confidence in the vaccines. Therefore, this barometer was also used in the Union project, the Coalition for Vaccination. They used our barometer to survey the confidence in their members. And that's the reason why we have also now much more languages available. So the survey is applicable in more languages. If I can have the next slide. How we see the use of this vaccine training barometer in the future is that we would like to use this vaccine training barometer prior, when we are developing a vaccinology course, to really assess the need, but also to assess the need on the certain topics that they want to have in a tailor-made vaccinology training. And this vaccine training barometer could also be used to collect questions healthcare provider could not answer. And we see this as an input for a frequently asked module or a fact-check model that can be created to serve as an information tool for healthcare providers. So we think that this vaccine training barometer could really a sustainable tool that can be implemented in the different countries. If we can have the next slide. So besides the healthcare providers in service, we also assess the need of students to have more information on vaccines. So we, thanks to the coalition members or the student organizations that are part of the Coalition for Vaccination, they distributed our survey for students. And we got more than 3,500 responses, and we could conclude out of this assessment that 1 in 3 students doesn't feel confident to reply on questions about vaccines. Half of the medicine and nurses and pharmacy students indicated that an extended module on vaccination in their curriculum was really needed. So they need more information in their current training. If I can have the next slide. So if we base ourselves on the outcome of the healthcare provider survey, so the barometer and the students, there on this we created together with what we were learning on a list of training on vaccinology that already exist. We used all this information and we collected all of this and we created an optimal or a curriculum that can be used for students as well as for healthcare providers. If I can have the next slide. So this module, the training curriculum for in-service and pre-service training contains 8 different modules. It goes from the immunology, from the history of immunization until the practical skills. Everything is very well described in a part of minimum content and a maximum content, and we for each module we specify very clearly the learning outcomes. So at the end we had a complete curriculum that is available on our website, and that will also be available on the EU-JAV websites when the report is approved. Can I have the next slide? So once we had this curriculum, we wanted to pilot test it in the 2 settings. So in the healthcare providers in service and in the students part. But due to the COVID pandemic, it was very difficult to organize a meeting where we brought together the healthcare providers and the students. So what we did is we did a pilot testing in our summer school of vaccinology that we organized last August. And there we took into consideration the curricula. We based ourselves on the curriculum to create the training for the students, and an app was created, and each session could be evaluated by the students. So based on this evaluation, we optimized the curriculum after we did this pilot testing. But we thought that it would be also good that we had some input from the healthcare providers themselves and not only the students on the curriculum, and therefore we did a review round of the curriculum in the Coalition for Vaccination. So we asked all members of the Coalition for Vaccinations and the Scientific Advisory Board of the Immunion Project to review this proposed curriculum, and we took into consideration all updates, and we adapted the curriculum so that we can say now that we have an optimized curriculum that we see as a tool for, or as a quality tool to see if you have a training, you can check if all parts of the curriculum are mentioned in your training, or you can start with this curriculum to build a new training if you want to have an optimized training. So if I can have the next slide. So what we take out of our work that we did in the EU-JAV, what are the sustainable outcomes, because we were part of work package 4, where we want to create a sustainable outcome. We have 3 major things created that can be used in all countries. So first of all, we have a curriculum on vaccine and vaccination that can be found on the website of the EU-JAV, and that can be used as a tool to create new trainings or to optimize your existing training. We have the vaccine training barometer, who is really a sustainable tool. We would propose to, before starting to create a tailor-made training, to first run the vaccine training barometer in your healthcare providers so that you can adapt your training based on the needs of the people that need to be trained. And we already started to use this item, so the barometer and the curriculum, we use it now already in the new project in Union, where we develop, based on the curriculum, a train the trainers model that will be given in June of 2022. And also the vaccine training barometer was used to assess the need for training in the coalition members. And this was done last December. So we already used the training barometer. So in conclusion, we can say that we have developed in the EU-JAV a major sustainable outcome that can be used to optimize the healthcare providers training as well as the students training. And we really would appreciate if this can be used in next projects.
Thank you, great. And of course, you stay with us for the discussion. We'll move on to the second presentation now with Ginevra Papi from the ECL. Dear Ginevra, are you with us?
I surely am.
Yeah, well, so welcome and good afternoon. So the floor is yours, Ginevra.
Thanks a lot, Majid. And actually, I believe I'm the last presenter of the day. So I want to thank the audience for sticking out with us, both online and in Paris. And also, I join Greet in thanking the EU-JAV coordinator and our work package leader, Majid, and the team at the Ministry of Health and Solidarity in France for the kind invitation. So my name is Ginevra Papi, and I am the communications officer at the Association of European Cancer Leagues, based in Brussels, and I'm delighted to be here today to present, hopefully quite shortly, the work that we did towards developing an effective strategy to raise awareness about vaccination among a cross-section of European young people. The strategy was actually co-designed and implemented with a very valuable input of our youth group. And you can see some of them here on the left-hand side of the slide. We call them the so-called youth ambassadors for the European Code Against Cancer. And essentially, this is a network of about 50 students and young professionals aged anything between 18 and 35 years old. They come from different countries and backgrounds, and they're based across the WHO European region. And they all have an interest in health promotion with a focus on cancer prevention. And essentially what they do is really to promote and disseminate at the local level the messages of the European Code Against Cancer, which is a health literacy tool that hopefully some of you are aware of. And the European Code Against Cancer actually includes a specific message on the importance of vaccination, especially vaccination for hepatitis B and HPV. So as I mentioned, the strategy was that we co-designed entailed the implementation and also the evaluation of 2 pilot Europe-wide competitions. The first one in 2019 aimed at school-aged children between 7 and 18 years old, and the second one focused on young people up to 25 years old. So let's have a look at the 2019 competition a bit more in detail. It took place in March, around March, April 2019. What we did was really we reached out with the help of our youth ambassadors to schools principals in various schools, primary and secondary, across the WHO European region. And what we wanted is that they would help us kind of engage in students and ask them to work in groups of 3 to create public service announcements, in particular posters and short videos about the importance of the hepatitis B and the human papillomavirus vaccines, as well as their uptake. And these public service announcements that they created were meant to raise awareness among their own peers. So what we asked was that the teachers would kind of introduce the topic in perhaps a session or a module, and that the messages included in such service announcements would be in line with the info provided, the official information provided within the European Code Against Cancer, which was developed by the International Agency for Research on Cancer and by the WHO. You can see a bit on the right-hand side, when it's too small, a bit how many countries participated and kind of the age group. But in short, we received about 40 submissions from 10 countries across the WHO region. And what we did with we shortlisted the posters and video and disseminated them widely on social media during the European Immunization Week. So this is one of the official awareness observances that's coordinated by the WHO Europe office. So what we did is we put them all on social media, in particular on Facebook and Twitter, and we asked people to vote on their favorite entries. So the submission that received the highest number of likes across all platforms were declared the winners on the last day of the European Immunization Week. Next slide, please. And now briefly, I wanted to also give an overview of the 2021 competition, because actually it was slightly different in format. As you can imagine, back in 2019, it was still pre-pandemic times. So it was actually feasible to reach out to schools. But in 2021, we had to adapt the format. So differently from the first edition, the target group this time was not actually school-age children, but it was more like teenagers and university students. And we didn't ask them to work in groups or work in a school-based setting, but they could work on their own submissions in the spare time, and they did not need to be affiliated with any schools or universities. The competition, once again, was around March, April to mark the European Immunization Week, because we found during the first edition that it kind of helped boost the message a bit more to capitalize on such an occasion. And the special focus this time was on the HPV vaccination, because we also wanted to raise awareness of the global strategy to eliminate cervical cancer as a public health program that had been published by the WHO. This time also a novelty was that we had two different categories. And the first one was the creativity competition, which kind of welcomed different types of simple and complex graphics. Again, posters, but mostly digital, but also the type of thing that young people like more, for instance, memes and GIFs, stickers. And we also accepted short videos for that category. We also wanted to add a slightly more complex category for university students. So this time we also introduced a case study competition. So we asked participants to design potential interventions to promote the uptake of HPV vaccination in their local context based on their own research. This time, again, we did provide participants with a list of facts about HPV and cervical cancer, so that they could also learn evidence-based facts in the process. And also we give them a list of free design softwares and websites that they could use to create their own designs and graphics. So there was also these didactical aspects in comparison to the previous edition. In one last thing I wanted to mention that was different from the previous edition was that we wanted the competition to kind of continue with some sort of follow-up activities. So we didn't want to just have something in March and April that ended like that. So we did an extra effort to ensure that there was some sort of follow-up, especially from our youth ambassadors. So as after the competition, our youth ambassadors organized a live session on Instagram with the WHO cancer ambassadors to discuss the topic of vaccination more in general, as per the EU-JAV, as well as delve deeper into into vaccination for cancer prevention. And then also our youth ambassadors based in Bosnia, Croatia, and Serbia actually created a video with VIPs and influential personalities from their own region. Some of them were cancer survivors themselves or just influential personalities to raise awareness of the vaccine in their own region. And they also organized a webinar with experts and scientists aimed at young people to discuss the topic further. Next slide, please. Okay, so I'm coming to the conclusion of my presentations. So basically, what was the value of implementing our two pilot communication action focusing on young children, and what should we kind of take stock of for the future and to make this more sustainable in the future? So some of the main considerations I've added here in the slide. I'm not going to read them out, but I'm just going to point out a few of them. And I think most importantly, what's important from our pilot communications is that they can now provide some sort of benchmark to assess future competitions. But to look a little bit more in detail on the lessons learned, I think basically free online competitions, we found that free online competitions are a fun and engaging way of raising awareness of vaccination, and as well as raising awareness of, let's say, the project / the brand, in this case, the EU-JAV. And also it's a fast and cost-effective way of build a follower base of followers that usually you wouldn't get from organic content. We also found that it was really useful to capitalize on specific awareness days and months, especially the European Immunization Week. And there's also an awareness day specific to HPV. So our communication efforts really were amplified through these kind of observances, and both at the national and international level. And the final point, maybe from the lessons learned that I want to raise here, is that we found that peer-to-peer communication was very essential. So our youth ambassadors were instrumental in helping us reaching out to schools, because they're not one of our target groups at the Association of European Cancer Leagues. So we mainly communicate and represent cancer associations. Some of them do work with young people and with schools, but it's not a direct target issue. So it was very important for us that peer-to-peer communication happened, and that young people got to know about the competition from their own peers. Two final points that I wanted to raise were more on the negative side of things, lessons learned, where that it was quite difficult, and probably this point links to the previous session on vaccine hesitancy. It was quite difficult to getting primary and secondary schools involved in our competition, even before the first wave of the COVID-19 pandemic, because as mentioned before, this is an increasingly sensitive topic. So teachers were actually not very willing to introduce the competition to their own students and or include a specific lessons on vaccination, aside from the one that's meant in their own national curricula. And the teachers were not really willing to ask permission to the parents to get their students involved in extra activities. So there was a bit of a caveat, and that's why in 2021 we changed the format a little. And another thing is that, of course, organizing Europe-wide competitions required much more time and resources than what we planned for. So probably small NGOs like ECL are not best placed to lead on the implementation and evaluation of the competition. Actually, we couldn't really evaluate it in a way that we would have wanted. We didn't have resources to do proper implementation research on the ground to assess what was the impact of the competition in terms of knowledge of vaccination and behavior change. So we think that if the Ministry of Health or their contractors at the national level were to take on this project, it would be probably easier for something like this to be run by a big organization. And I think I'm just gonna end here, and thanks a lot for listening.
Thank you very much, Ginevra.